Person was asking me, now you born by yourself? Now you born by yourself? Like, what kind of nonsense question is that? I had to reply and say, no, not be me born by myself. I no born am myself. I carry the belle give my sister, make she born for me. Then she can't help me born am. Hi guys, welcome back to my channel. How are you guys doing? Hope you all are doing fine. It's been a long time on this channel, even after I promised that I'll be consistent. Good. It's not even easy at all. Creating content on YouTube is not easy. In fact, creating content on any social media platform is not easy at all, especially when you have other things doing. So trying to keep one particular platform busy is it's a difficult task for me. I don't know about any other person because I don't have a help. I don't have a second hand. You get, so combining wifey duty, being a mother, your work on different platforms, and then to your YouTube channel. It's a difficult thing for me. It's not really easy, but I will be trying. Yes, of course, I'll be trying by God's grace and with the help of God. I'm going to be trying my best. Now, today I'll be talking about CS mom. CS is that's a Caesarean session. Caesarean Caesarean session. There has been a lot of, well, I call it misconception about CS. There has been a lot of negative things people say that surround CS. And people have said so many negative things about CS delivery. They see it as something abnormal. They see it as an abomination. They see whoever give birth through CS as an incomplete human. Yes, they see a woman who gives birth through CS as an incomplete woman. They feel the person isn't fit to be talking among other women who give birth through vagina delivery. I mean, I don't know why they keep treating these women in that manner. I don't know why they keep treating CS mom like that. There's nothing wrong with giving birth through CS. There's nothing wrong with it. Please. People should stop sending these women, especially the ones who are pregnant, into depression because some of them don't even know if now, yes, some of them don't even know if they're going to be giving birth through CS or not. And when at last doctors say, hey, your delivery is going to be through CS, their hearts skip. In fact, their BP goes high, goes up because they have heard a lot about CS being bad. They've heard a lot about, I mean, they've heard so many negative things about CS. There's nothing wrong with it. Truly speaking, there's nothing wrong with it. Every woman who gave birth, whether through CS or through delivery, are the same. They are the same women. They all give birth successfully. What we should be talking about is whether they give birth safely and whether the mother is safe and the baby is safe. Whether the mother is healthy and the baby is healthy. That's what we should be thinking about. And not talking about whether they cut your tummy, whether you there's way somebody put it the other time when I gave birth. The person was asking me, now you born by yourself? Now you born by yourself? Like, what kind of nonsense question is that? I had to reply and say, no, not be me born by myself. I no born am myself. I carry the belle give my sister, make she born for me. Then she can't help me born am. Since you don't have sense. Since you don't have sense. Like, why would you be asking a woman that kind of question? I just gave birth and you came to visit me in the hospital. You're asking me, now you born am yourself? Hey God, though, I don't really understand. I don't really understand. I don't know why we are thinking like this. And this is coming from adults, not even children. This is coming from adults. Now, what prompts me making this video? The reason why I'm saying this is, look, I have heard about it a lot on the internet space. People have been saying nonsense, saying whatever is in their mind. I mean, typing whatever is in their mind when it comes to CS issues. But look, the reason why I'm saying this is I have two pregnant friends in my street. I have two pregnant friends. I mean, two pregnant women in my street. They have been looking happy and joyful, awaiting the arrival of their baby. So these women are pregnant, and ever since their tummy shoot out, I mean, ever since their pregnancy became visible, as in when you see it, you know that this is the pregnant woman. I noticed. I mean, they've been happy. They're looking bubbly. They are looking joyful all the time, awaiting the arrival of their babies. Now they came back from antenatal yesterday, and one of them was looking moody. I mean, she was looking moody. And when I asked her what the problem was, guess what she said? She said she went for antenatal, and just like every other pregnant women there, she was also seated. And then some people were already side gossiping. I mean, they were gossiping by the side about women who give birth through CS. They see CS as an as an abnormal thing. They see CS as an abomination. They feel whoever gives birth through CS isn't fit to be in their midst as a woman. Whoever who gives birth through CS isn't fit to be in women meeting, isn't fit to be an exco in women's group. Hey, God. They said whoever gives birth through CS is not a strong woman. What is the definition of being strong, please? What is your definition of being strong? So when you give birth to the so-called vagina you're talking about, it means you're a strong woman. You don't really have sense, honestly speaking. As a woman and you have this mindset, you don't have sense, truly speaking. There are women who give birth through vagina and there's no single knot in their head. They behave like people who have lost it, or they behave like people who are insane. And here you are sending a pregnant woman into depression, sending a fellow pregnant woman into depression due to what is coming out of your mouth. Like, why? Why are we like this? Why are we doing this to ourselves, women? Why are we doing this to ourselves? This is wrong on all sides. It's all shades of wrong. I mean, they were already bad mouthing those who have given birth to CS before, and they're still bad mouthing those who have been booked for CS, those who have been told that, look, your baby is breached and you're going to give birth to CS. They're already bad mouthing them and sending them into depression. What if these women take their life because, I mean, what if they commit suicide because of what is coming out of your mouth? What if so many bad things happen to them as a result of the words coming out of your mouth? Why shaming women who give birth to CS? Look, I'm a CS mom. I am a CS mom. And I will say it anywhere and at any time. I can say it anywhere and any time. I'm not ashamed of it. I am not ashamed to give birth to CS. If you're a woman here and you give birth to CS, don't be ashamed of it. Don't be afraid to say it at all. Don't be afraid to say it. And in my next delivery, I will still prefer CS. Even if I'm going to have 4 kids, I'll prefer CS. The first delivery was because baby was breech, and truly speaking, not even because people were bad noticing CS, but I just felt it's my first time. I don't know if it's going to be successful because I know both vaginal delivery sometimes isn't successful, and same thing with CS. Everything is 50-50. Whether you're giving birth through the vagina or you're giving birth through CS, it is a 50-50 chance. You just need to commit yourself into God's hands so that you can deliver successfully, whichever method you're using to deliver, so you can deliver successfully. So I prayed about it, and as a first time mother, I had to contact people who I knew who have been there before. I just needed a words of encouragement from them. It's not like if I feel that if I give birth through CS, I won't be a strong or I won't be sent a strong woman. No, what I saw there is that I just needed encouragement. I just needed encouragement. I just needed to be strong for the whole process to come and go. And surely the whole process was something that's, I mean, I didn't expect it. It was so smooth, it was so free. There was no issue at all. And I gave birth. My baby, I was sound, I was okay, my baby was okay. We didn't have any problem. And under 5 days, I was okay. They discharged me. It wasn't even up to a month. I got healed. The scar, it's just the scar that was there. Even the scars were not so visible. The scar isn't so visible. So I was healed, and that was it. I started asking myself, what is all this shenanigans about delivering through CS? What's the negative things people are saying about CS? There's nothing wrong with it. There's nothing there. I'm here to tell you that I've been there before. There's nothing wrong giving birth through CS. And anybody who is going to counter it, tell me yes, everything is wrong through CS, I'm going to treat your fuck up. I am serious. I'm going to treat your fuck up. If, oh my God, you see this friend of mine, supposing I was there when these women were saying this nonsense, when these women were side gossiping, and I heard it, I would have given them a piece of my mind. I would have treated their rubbish there right instantly. And I've given them a piece of my mind. Stop it. Stop shaming women who give birth through CS. Stop shaming women who even give birth through surrogacy. Stop shaming women who give birth through surrogacy. Yes, stop it. That's even a topic entirely. That's a different topic I'm going to treat entirely. Stop shaming these women for God's sake. Stop shaming those who have not even given birth at all. Stop shaming single ladies. Stop shaming single women. Get sense. Get sense. Get sense. I'm really livid because This friend of mine has been moody. In fact, she has been into depression. She said it happened yesterday when she went for antenatal. And oh my goodness, I wasn't happy. I wasn't happy. If I have the opportunity to follow her to the next antenatal appointment, the next doctor appointment, truly speaking, I will go very early and I'm going to make sure I address these women. I'm going to make sure I address these women. And it's really annoying that some nurses will even hear these women saying this and they will not even say anything. They won't even say anything. Even some nurses are culprits in this issue. Like once a woman is being booked, once the baby is breached and they find out that the baby is breached, these nurses treat them like they are outcasts. Treat these women like they are outcasts. It's wrong. It is wrong. Please let's do better. Let's do better. Do better as a woman. Do better as a female. As a female, do better. There are other things to think about in this life. There are other things to talk about. It's not about how someone gave birth or not. It's not about the delivery matter. Like I said, if I'm going to deliver again, I'm going to make sure that my delivery is going to be true CS. Call it operation or whatever, but I prefer it. I don't want to experience labor pain. And there are women thinking like me who also do not want to experience labor pain. Stop shaming them. Stop shaming us. Stop shaming us because if I catch you, me, if I catch you, I'm going to treat your fuck up. I'm a no nonsense person in this very issue. If I catch you, I'm going to treat your fuck up. You won't like it. You won't like your encounter with me. So, guys, that is all for today. And please don't forget to turn on your notification because it's just like this topic like this will be coming up. I'll be treating it. I have a lot on my table. I have a lot that I want to talk about. It's just time. It's time. So turn on your notification bell so that whenever I post a video, you are going to get notified. And don't forget to subscribe. Please, please, Ejo, need to run along. Please, I beg in the name of God, don't forget to subscribe and give me a thumb up. I beg in the name of God. Give me a thumb up. A thumb up. I will do well next time. Yes, definitely I'll do well next time. Bye.